Hello, everybody. Welcome to our session today. We're just going to give it a couple of minutes for everyone to join and then we will get going. Whilst you're waiting, if you want to pop your name and organisation in the chat, that's really helpful to know who we've got and say hello. So we will be back in a second. Hey, we look like numbers are just stabilising a bit, so I'll get going with housekeeping and then hopefully any latecomers will still get the actual main content. So welcome everybody to our webinar session today, celebrating homegrown technology in social care. It's really great to have plenty of you here and to embrace our new digital care in focus themes that we've started at the Digital Care Hub. So we've had a whole series of content this month looking at digital innovation. So if you haven't seen that, do go to our website. There's loads of interesting stuff there, and this is part of it. So thank you for joining us. Okay, so just a little bit of housekeeping before we start. The webinar is being recorded for those of you that didn't hear that start at the beginning. For our attendees, you are on mute and you can't be seen. We would, however, still love you to engage with us, chat to us via using the chat function that you're putting your intros into now. If you've got a specific question, however, we would love you to use the Q&A function. So it just gives a slightly different functionality at the back end of the webinar and makes it a little easier to manage. So if you can remember to use the Q&A function, that would be great. We will either answer the questions as we go along, or if we can't do that, then we have got 15 minutes at the end specifically for questions. So hopefully everything you want to know will get answered. You will get access to the recording and to the presentations after the session. So we will make sure they get sent out to you. So don't panic about taking notes or anything else. I think that's everything from a tech perspective. So just quickly, a little welcome from Digital Care Hub. So my name's Fiona, I'm one of the engagement managers. And for those of you who haven't heard of us, we are a national not-for-profit and we support the social care sector in embracing digital technology and most importantly in doing so safely. We have a whole host of resources, tools, information available on our website via events, webinars, etc. So if you haven't come across us before, do take a look on our website or reach out to us. We're quite a friendly bunch. We can normally point you in the right direction. Okay, so quick agenda before we get going. So obviously quick welcome and housekeeping from myself. Then we are really lucky to have Paul Cooper from the Home Care Association, who's going to do a nice introduction for us, just set the scene, thinking a little bit about digital innovation and what that means across the sector. And then most importantly, we've got some really brilliant provider insights. So Khaled, Sharon and Kate are all going to share their experiences of sort of in their care settings and care organisations of how they've embraced digital innovation. And then finally, it would not be a Digital Care Hub webinar without 10 minutes from the lovely Cyber Sam from the Digital Care Hub. And he will just be giving us a few little reminders of what we should think about from a cyber perspective to keep ourselves and our information safe, whether we're buying off the shelf technology or developing things in-house. And then hopefully plenty of time for Q&A at the end. So hopefully that will make sense, and we really look forward to hearing some really exciting insights. So I will, without further ado, pass over to Paul. Thanks, Paul.
Lovely. Thanks, Fiona, and hello, everyone. As Fiona said, I'm Paul Cooper. I'm Senior Quality Compliance and Innovation Specialist at the Home Care Association. I'm an occupational therapist by background, and I've worked across social care, the NHS, charities, and the private sector. So I'm really pleased to open today's webinar, and thanks again, Fiona, and the Digital Care Hub team for inviting me. So just a bit about the Home Care Association, if you don't know. So we're the UK's national membership body for home care providers. We represent over 2,000 organisations, and we work to ensure that home care is valued, properly funded, and delivered to the highest standards. We advocate with government, regulators, local authorities, and we support providers with training, resources, guidance on compliance, quality, and workforce development. I also run a members helpline, and we champion members doing things differently, especially through technology and digitalization. Um, Essentially, with the goal of helping people to live independently and with dignity. So I've been at the Home Care Association for 7 months now, and I've seen what an entrepreneurial group our members are. Many have been using digital technology for years, and many are leading the way to with creative digital solutions when off the shelf tools just don't meet their needs. I'm really looking forward to hearing some of the practical stories from providers today who've built and embedded digital tools themselves. As it said in the details for this event, digital innovation is no longer a nice to have. One of my roles, and actually on a meeting this morning with the CQC, was um, a stat that comes through quite strongly is October 2025, 81.1% of CQC registered adult social care locations in England now have a digital social care record. Now, this is up from 74.7% the year before. This is a huge milestone and supports safer information flow and really frees up staff time. So the use of digital technology and data isn't about digitizing for its own sake, of course. What the increased use of many forms of digitization shows is some of it is no longer innovative. Having worked myself across the NHS and social care in my career, I've seen the challenges between the two systems. So for me, the real step forward would be embedding digital systems that can actually work together, both within organisations and across sectors. I really like Digital Care Hub's definition of innovation, which I was reading the other day. So, to paraphrase, innovation is about trying new or different ways of using technology and information to improve outcomes, especially when what we currently do isn't enough. It's about testing ideas, learning from what happens, and being willing to take proportionate, informed risks to move things forward. So, I really like that definition. At the Home Care Association, we hear from providers, excuse me, all the time who want to modernise for practical, financial reasons and for better outcomes for people. But there's also a clear national policy push. So government ambitions include the consistent data and tech standards, mandating information standards and clearer rules on how care data can be accessed, shared and reused, all aimed at safer, interoperable systems. So the Digital Hub has some sort of details on that as well, which I'm sure they'll be happy to share with you. So alongside this, the NHS 10-year plan last year highlighted major digital ambitions, including data-driven decision making, AI, robotics, wearables, and predictive analysis. In social care, digitisation will also feature strongly in the Casey Commission review and in Home First prevention focused models like the NHS led neighbourhood health work that's currently being developed across England. Having worked in teams myself similar to neighbourhood health as an OT, I know this will only be effective with the inclusion of social care partners and digital tools. And of course, there's AI. What talk wouldn't be complete without an AI kind of chat. The various elements to talk about, and I obviously won't go into all of them today, but some things that we're seeing right now, I think an important thing is a real push for clearer guidance on using AI safely and responsibly. So this is timely as some providers have already been picked up by CQC inspections for uncontrolled use of AI with confidential records. It's clear that strong governance and proper human oversight are essential. And CQC itself has signalled that it will develop a policy position on AI and is even trialling an ambient voice tech to transcribe conversations during inspections. So I'd be interested to see how that works out. We're also hearing more examples of AI being used to support workforce management, matching carers with clients, improving scheduling, and helping retention. AI will also, I'm sure, continue to surprise, astound, and probably terrify us a bit. But for me, the priority must be to see it as a partner, using it to remove repetitive tasks and support better, faster decisions, not replace human relationships. So beyond AI, the digital tools in people's homes have transformed how we work. When I was thinking about my experience as an occupational therapist, having worked in local authorities for nearly 10 years ago, one of my former roles was at a clinic and a day centre doing assessments for equipment in people's homes. Things have moved on massively since then with ease and accessibility of these tools are on a completely different level. So many providers that we're hearing about are also using sensors and smart devices to anticipate issues before they escalate. Pre-care approaches where low-level digital devices alert us before someone needs hands-on support I think, are exciting and growing area. Technologies that predict and prevent falls are another strong example. This drive towards prevention must be something we get better at, and given it was embedded in the Care Act many, many years ago, it's nothing new. Robotics. Now, this is developing quickly. At the Home Care Association, we recently had a tech conference where we heard about humanoid robots like Neo that are no longer science fiction. They're capable of already doing basic tasks, and the costs will come down. Used well, they can free up carers from repetitive or physical work, and they can also, so the carers can focus on human connection. Given we've got a growing problem with loneliness, and this is responsible for worsening health outcomes, I'm particularly interested to see how AI and robots work together to provide some answers to this. We also practically need to keep an eye on the analog to digital telecare switchover by 2027. So providers need to be checking equipment, resilience, and contracts now. So all these developments support the shift towards home first care, preventative and wider digital transformation, but investment and incentives don't always keep pace with the ambition. Analysis from organizations like the Health Foundation show that the need to strengthen community-based care and funding is there. It will also be interesting to see how neighbourhood health plans develop to support this direction. So, from an anecdotal perspective, at a recent conference I attended, providers and tech suppliers agreed on one thing: building a strong business case, showing clear outcomes, financial savings, and better well-being for people, all of which are crucial. I'm keen to hear how the presenters today have approached this challenge. So, to finish, I'll share a line from one of my favourite writers, David Brooks, in his book, How to Know a Person. He says AI may replace many tasks, but one thing it will never be able to do is create person to person connections. People in care are experts at that, I believe. Um, as he says there, AI and all digital tools really will become more influential and a partner in the care that we provide. We just need to keep making the case for greater human connection alongside this tech. So that's it from me. For now, I'll hand over to Khalid. Khalid, over to you.
Well, thank you, Paul. So, my name's Khalid. I'm the managing director of Sunnyside Nursing Home, a Trustworth Group, and I'm also the CEO of Quickify. Quickify is a AI-powered digital care records platform that we developed internally for our own use. And I'm going to be talking a little bit today about how we built that platform. So, yeah, next slide. So what I'm going to try and cover today is a little bit about why we built up, why we built our own platform. A bit about how it works. I'm not going to go too much into how it works today because today is really, I think, more about the innovation and the process of innovation. But I will give a brief demo about how it works. The challenges and barriers to innovation that we faced, how we overcome those challenges, the outcomes and benefits when we, in developing our own technology. I'll go through some tips that, some learning experience that we've had, and also maybe think a little bit about the future and the challenges and opportunities around building your own tech in the future. Okay, so
Apologies, Khaled. Sorry, I've
right.
just removed slides for a second. I think they've got an auto sort of transition on them. So I'm just going to take that off.
Okay.
If you don't mind just carrying on talking and I'll sort that in the background.
Okay, no
Thanks,
worries.
Khaled.
So a bit about us. So Trustworth, we're a small family-owned care home operator, started by my parents back in 1984. So we've been going a little bit over 40 years. Over the years, so myself, I came into the care sector about 2002. I've got a previous background working in engineering, IT, and research and development. So I worked for a Silicon Valley tech company for about 4 or 5 years. And then came into the care sector to sort of take over the family business. we were always quite low tech, so we were paper based for many years. We did start building some tools, so we built a billing platform and some HR tools and so on, which we no longer use. So we've got the experience of developing tools which didn't really, well, they worked, but they weren't significantly different to what you could buy off the shelf, sort of thing. And I'll talk a bit about that later. So we don't really use those billing and HR platforms anymore. But about 2016, we started building our own digital care platform. We were looking to go digital, and I'll talk a bit about that process today. And Quickify is the platform that we've built. So why did we decide to develop a platform of our own? So we were looking, like I said, in about 2016, we were looking to go digital with our care planning system. And we looked around what was available on the market. And I would describe it that the first generation of digital care plan platforms were desktop software. So, running on a PC or running on a laptop, you could centralize your data and they could give you a nice, readable output. But then the second generation of care systems came along, and these were cloud-based applications. This is what we were looking at the time, around 2016. So you'd have a cloud-based application running on the internet, a mobile app. They really solved the problem around scalability. So, data entry, point of care recording with a nice mobile app and so on. And there were lots of, good solutions around. But there was a particular set of challenges that we wanted to resolve around care planning, which the existing solutions didn't really solve. And so we decided to build our own platform. So what were the challenges that we were looking to solve? Well, there were four main challenges that we were looking to solve. Next slide, please. And they were around time, quality, compliance, and personalization. Time. So we run a elderly dementia nursing home. It was taking, when we got the new admissions, it was taking roughly about between 6 to 8 hours to create a new set of care plans every time we got a new admission. So we wanted to do something, and then, it doesn't take quite as long, but it still takes a long time to, update and review those care plans. So we wanted to build a tool that could help automate and reduce and do some time saving. We also found that some care staff would write the care plans differently. So you might get one member of staff who's really good at wound care and another one who's really good, with dementia care, and you could get variable quality depending on who was writing the care plans. So we wanted to build a system that could help standardize, quality. And then there were other issues around, very often with paper-based systems, if you're updating one record, because somebody's care needs have changed, you can't always pull through, or you might get inconsistency between the records because if somebody's care needs have changed, you haven't pulled those changes through. And we also wanted to improve the personalization in the care plans as well. So those were the four challenges that we wanted to resolve, and we felt that the existing systems, when we started out, didn't address them in the way that we wanted to, and that's why we decided to build our own platform. So what did we build? So I'm going to do a quick demo of some of the tools that we've built. So that still requires, that requires constant monitoring, feedback, and testing, project management, and so on. So so innovation. If you're going to try and if you're going to be trying to build your own tools and so on, bear in mind that it does take a lot of time. And it's not just time; it's also what I've put in there: context switching. What I mean by that is that the challenge of doing innovation is very different from the day-to-day task of running a care service. So, say for example, if you're thinking about in our case, thinking about how we build a new behavior care plan template sort of thing, and you need to sit down and you need to some thinking time and so on sort of thing. And then immediately somebody calls up and says, we don't have a staff member to cover this particular shift, and so switching context between doing that kind of innovation type of work and switching to kind of like the operational challenges of running a care service is a real challenge. So and I think that's so it's just to bear in mind that. So the first three bullet points: time, cost, and skill and expertise, are all around resources. And so you need to plan and make sure that you've got sufficient resources in place to do innovation. Software development is very expensive. And it's not just the cost of developing the technology itself, there's also a maintenance cost. So don't just think about, how much is it going to cost us to kind of build this tool that we want to build, but there's an ongoing, maintenance issue. You've got to do bug fixes. You've got to make sure that, the security is patched and up to date and so on. Skills and expertise, there's many multidisciplinary skills that you'll need. There's obviously, if you're building software, to be software development and technical skills, you'll need subject matter experts. You'll need people to do testing. You'll need people who have got experience in things like cybersecurity, clinical safety testing, data protection, and so on. So making sure that you've got the right skills and so on in place. And then two more challenges that I think are around. One is around quality standards and accreditation. We see that when we first started out, there wasn't really a lot of regulation around digital care records and so on, but that's increasingly changing. So these are both required standards and kind of de facto standards. So you've got things now like the NHS assurance standards, cybersecurity standards, and what I expect to see increasingly is that a lot of things that are kind of labeled social care are going to be falling perhaps into medical device standards as well. So that's something to look out for. And then the final barrier, I think, is or the final barrier on this list is resistance to change. When you start, I think that it's fair to say that the care sector is quite a conservative sector in general, and there are barriers to change. I mean, when we started doing digital care records about 10 years ago, even ourselves, we were quite even nervous about putting care records out on the internet, sort of thing, because just the idea of putting people's care records on the internet was terrifying, sort of thing. And it's fair to say that even CQC and commissioners I think were at best neutral and at worst maybe slightly even negative about digital care records and so on. Obviously things have changed a lot, but today it's AI but resistance to change is a barrier. So how did we get around some of those challenges? Well, we built our own small core R&D team. So we have a very small engineering team which we pay for full time, and then we augment them with additional resources as and when needed. So we've got a couple of software engineers who a team that work with me. And when we need additional expertise, we bring them in, as and when needed, and that helps us manage the cost. And it also helps us to be able to stay quite lean and agile as well. So what we mean by agile is that we try and have quite short development cycles. So if we come up with an idea, we try and build a prototype quite quickly, and then get feedback on it, and then iterate on the design and get feedback and have continuous feedback loops with our staff and so on. That helps us, manage a lot of the resourcing issues. It also meant that when we actually launched the product, our staff were pretty much, chomping at the bit to get it live and start using it. So it helps address a lot of those fear and resistance to change issues as well. So that's how some of the practices that we put in place to deal with some of the challenges. Next slide, please. And so what were the outcomes and benefits of what we had? Well, we have managed to save quite a lot of time on how long it takes us to create care plans. So when we get a new admission, we're getting an initial draft set of care plans done in about 20 minutes at the moment, and that's actually created quite a good business opportunity for us, because we do now do what was used to be called discharge to assess. So we're taking residents in at short notice and for short periods of time, and they don't stay for very long, sort of thing. If we had done that on paper, the amount of admin that it would take for to bring somebody in for 4 to 5 weeks and create a full set of care plans and so on would have been quite onerous. But the tool has really been able to kind of help us reduce that that admin and open up new business opportunities for us. It has improved the quality because we can create these care plan templates, so we can kind of standardize some best practice in all the care plans. And the way that we've built the tool is that when you update one record, we can pull changes through, so it's helped us to kind of like improve that compliance and so on. And it's also helped us to improve personalization, because when you've got that questionnaire, we can add in prompts for person-centered questions. So we can ask about things like likes and dislikes and choices and so on, and we can make sure that we have a kind of a base level of personalization in every care plan. Okay, next slide, please. So top tips if you're looking to build your own technology. This is just from our particular point of view. So the first is to try and clearly define the problem that you're trying to solve. There are a lot of good technology out there at the moment, and I would say there's not a lot of point in building something if somebody's already done something that can solve the problem that you're looking to solve. So so clearly define the problem that you're trying to solve. It needs to be big enough to be able to make it worthwhile investing in building your own technology, but it also needs to be small enough to manage. You shouldn't, depending on the size of your organization and the budget that you have and the resources that are available to you, you obviously don't want to be able to take on a problem that's too large for you to take on. The second point is be prepared to fail and adapt. We've had plenty of, we've failed more times than we've succeeded. But you need to be able to pivot quickly and learn from your mistakes and adapt and be prepared to do that. And there's a cost to that, because you build something, it doesn't quite work. You don't go back to the drawing board, but you make changes and so on, sort of thing. And it's a continuous process of discovery and figuring out what works. The other thing is be realistic about time, cost, expertise, and resources available to you and that will be required to undertake the project, and be clear about the intended benefits and outcomes. Sometimes, and I've been guilty about this myself, being somebody from a technology background, sometimes you look at something and you think, I could build that, and you have a go at it, and then you think, well, yeah, you could, but why? Because somebody's already done it, sort of thing. So I think, again, coming back to the point about, if you're building something yourself, be clear about what the benefits and outcomes are, and why you're actually building something that that can't be done with something off the shelf. Start small and iterate. So again, taking that agile approach. Involve your end users early and continuously. You don't want to be building something over 6 months or a year and then showing it to your end users and then them telling you that no, this is not going to work. So get them involved early and continuously in the process. Ensure compliance from day one. I think this is something that we didn't do initially, and that like we've kind of learned. So it's much easier to think about things like compliance and cybersecurity and standards and so on from day one, because going to re-engineer something after it's already been built is a lot more costly. So just to try and think about the standards that you're trying to work to from day one. And then the last point is around plan for long-term sustainability and maintenance. It's building your technology or building your system is just part of it's just halfway, really, because then it needs to be you need to then maintain it and kept up to date. Things change, and that obviously has a cost and and everything to it as well. And then finally, just a few comments from about where we see some risks and challenges and opportunities around developing your own technology. So because a lot of what we're doing is around AI, AI safety, in terms of risk and challenge, it's a big issue, for lots of different reasons, for people relying on it too much and it generating errors and hallucinations, yeah, I think that's probably the biggest one, and also biases and so on and things like that. So AI has got a lot of opportunities, but there are some risks and challenges there as well. One of the other challenges around future innovation, I think, is that we're going to be seeing, I think, a lot more regulation and compliance, and that'll cover things like AI, clinical safety, medical devices, cybersecurity, and around interoperability and so on as well. So I think that the initial barriers and costs to entry around developing your own technology are getting higher. So something that might have cost you, X to build, 5 years ago is probably going to cost you 2X or 3X to build, currently, because of the increased regulation and compliance involved. But then some of the opportunities. So we're seeing, and we're making use of them as well. Things like AI coding tools help, to reduce the cost and lowers the barrier to entry for, for building prototypes and so on. You still can't use it to build a production system, but you can help you to be able to kind of test ideas much more quickly. And something that I actually feel has got a real potential to enable innovation is the work that the NHS insurance team are doing around the social care interoperability platform. So, and the reason why I think that this is a really good opportunity is that currently, if somebody wanted to, do some innovation around digital care records or something, they'd probably have to build their own digital care records platform and then add their innovation on top of that. Unless they can convince one of their current suppliers to be able to do some sort of integration. But the Skip platform could act potentially as an integration platform to allow people to innovate and then to integrate with existing systems. And I think that it's a really big opportunity, and I hope it gets used in that way. So that's it for me, and thank you for listening.
Thanks so much, Khaled. Really, really interesting to hear your amazing approach and building your own tech. We're going to move straight on to our next lovely provider. So Sharon, I'm going to pass to you. We have got a couple of questions that have come through in Q&A. We'll pick those up at the end. Thank you very much.
Amazing. Oh, can you hear me? I'm hoping so, yes. Hello, everybody. Good afternoon, and thank you so much for listening to me for the next 10 minutes. So I'm Sharon Lowry. I'm the Chief Executive of an organisation called The Caring. I'm just going to give you a bit of context. I'll try not to repeat what Khaled said, which I thought was brilliant. But I think I'm going to come at it from a slightly different angle as to why we've done what we've done, and hopefully the benefits. So we're an employee-owned organisation, 100% employee-owned, no debt, no external shareholders, and we can invest in our workforce. Back in 2018, we were in quite a bit of difficulty: finance, performance, quality, culture, etc. We'd taken on contracts where the only way to make it work was to almost mistreat the staff, not pay properly for travel time, etc. And it was completely contradictory to the reason why we'd been set up in the first place. So it was the start of that transformation journey, and I think that's quite important. So next slide. So we went on a journey of changing how we delivered care. We paid our carers fairly from start to finish, full travel time, mileage, whether you're a cyclist or walker, all of that travel time was captured correctly, and paid properly. We had to extract data, use pivot tables, you name it. We had to make our systems work in any way possible because they weren't quite fit for purpose. I was quite lucky because I could bring my director of systems and performance. He was in the NHS, so we had this individual who could really help us use the data in the best way possible. We all know that there are minimal resources, especially when you're delivering local authority funded care, and it's quite important for us to use the data to ensure we put our efforts in the place that's going to have the biggest impact, drive quality and make a difference for the people that we employ. So we went on this journey for a few years, and it was a continuous improvement journey. Our CQC ratings were going up and up. We've had every rating going, so I'm pleased to say that we've now got outstanding and good across the board. We did, although we recognised our systems weren't fit for purpose. We had a sort of a coordination system, which obviously we could do our rotas, etc. And then we had a care planning and risk management system. The two, they didn't really talk together very well, talk to one another, and they were quite clunky. So we did go out to market a couple of times. What we found was these providers would say they would do everything, or they would say they would do certain things, but then when we got into the detail, it wasn't there, and we just didn't want to go from the frying pan into the fire. So we thought, actually, we've got all this expertise, we've got all this knowledge, we've got a new model we've got the it's like gold dust, really. We could we felt we could work with some developers and get something that could potentially transform the sector. Next slide. So we met. I think this was the difficult bit. So we'd got a new model. We knew what we wanted, but actually we're not software developers. That is not what we do. We met numerous potential partners. Um, and at one point, I thought it was never going to happen, but we kept going and finally found a couple of developers who'd worked in different sectors. They'd built software, they'd actually sold the company, and they were looking to do something else. And they were looking to give back and make a difference. And that was the bit that was so important to us. We were very much aligned. So we went into this as a joint venture. Be Caring kept the majority stake in the organisation, but we built the partnership through aligned values, which I think is probably one of the biggest recommendations I would like to make. We've been building the system for a couple of years and we're on the verge of implementing that internally in Be Caring. If all goes to plan, we will absolutely make sure it's fit for purpose before we take it to market in late 2026. Next slide. So just a bit more information, it might give you some ideas. So the majority of CareView 360 is owned by Be Caring colleagues. Be Caring is 100% employee owned. So, and it's a bit like the John Lewis model. So we can pay out sort of tax-free bonuses, which is always goes down well at Christmas. So if this is successful, it will be our colleagues, our carers who will feel the benefit from that. Ultimately, what we'd like to do is continue to develop CareView 360 in line with, the 10-year NHS plan, in line with the integration agenda, the prevention agenda. We're working very closely with our NHS colleagues. I genuinely think our social care workforce on the ground are incredible. They're undervalued, underutilized. They could play a massive part in the prevention agenda, and we need this government to put their money where their mouth is, recognise them, and I think there'll be it'll have a huge impact. And what we would like to do is continue to elevate the role of the care worker. And I think the model and the operational model and the digital solution has the potential to potentially transform the sector. And I suppose there is a bigger ambition in all of this. Next slide. I'm just going to sort of give you a few. I am not a software person at all, but one of the benefits of it's going to save so much time. Currently, we manually coordinate 25,000 visits a week. We have to work out what the right travel time is depending on the mode of transport. We have to build those runs. Our current system only does that in increments of 5 minutes easily. What this is going to do, it will automatically calculate the travel time, whether you are a driver, a walker, or on public transport. All Google Maps is enabled into it. It's very intuitive in terms if a call is cancelled and a run can be adjusted to create that efficiency, it will do that. It's going to give us all of the reconciliation data, so we confidently know we can pay our carers fairly and still remain financially viable. So I think this was the big thing that we didn't see in other digital platforms. Next slide, please. So it will be an all-in-one system. We currently have the two systems that don't talk to one another very well. It will be an all-in-one system. It will have you streamlined digital care planning, clear task management, medication outcomes, daily notes together. It's been designed by us. What we learned is we had to be really clear on the specification. I would completely echo everything Khalid said around the time it takes. Be prepared to get it wrong, but keep going, keep investing, keep building the relationships with your development team. There is twice as much testing needed as development time. We all, at the minute, it was all about development. You soon realise test, pick up those bugs, keep going. So we want to get it, pretty much fit for purpose. So when we do roll it out, hopefully the bugs are quite minor. Next slide, please. Yeah, I think the exciting thing for me is so at the minute we extract all this information, we've got spreadsheets galore. We and then we sort of send that back out, whether you are a care assessor, a care coordinator, a care coach, the managers, etc., the carers themselves. But we're going to have real-time dashboards that are going to be personal to depending on the role that you're in. So we can make sure we do our reviews on time. We make sure our carers are, we call them be supported, but the care the supervisions. So we will be able to pick out when our runs are inefficient. So it tips the balance to make it not necessarily financially viable. So all of the work we've put into the model is built into the system, and the right people at the right time will have the right information to make sure we take action when it's needed. Yeah, safeguardings. So there's the reason we've got the lighthouse is we want everybody to have that view of what's going on an individual's care, including commissioners, families, obviously the person themselves, the carers, the delivery organisations. That might be a long-term ambition. And I think, yeah, what we want to do, I'm sure all of you know that care isn't funded properly. So ultimately, once we get this going, up and running, and we're going to have accurate data, we want to use that data to influence decision making at a government level. So I think that's the exciting bit for me. But yes, hopefully I've not taken too long. And if there's any questions, please let me know. But a huge thank you for listening. Oh yeah. So yeah, sorry, apologies. One system supported end-to-end delivery. Oh, I'll let you go. Sorry, apologies.
Oh, Sharon, please don't apologise. That was
No,
really
I know.
brilliant. Thank you. Really, really, really appreciate your
It's very
time.
exciting, is what I will say, for the
No,
transformation.
really helpful to hear your insights and slightly different approach, but to see why you've approached that. We've again a couple more questions. We'll pick those up at the end. So yeah, I will move over to our final lovely care provider, Kate, who's going to take a slightly different spin because they've not built any in-house tech, but have approached implementation of tech in a really, well, I think, a really innovative and admirable way. So, Kate, I will pass over to you.
Thanks, Fiona. Hi, I'm Kate Doodson. I'm Chief Transformation, Performance and Digital Officer at Brandon. I think I've got the longest title in the world. So my responsibility is obviously software implementation, architecture, but also the data, and so the in and the out of that piece. I think I wanted to start almost by reflecting on the journeys that both other speakers have spoken about, and I've personally been through that journey myself. I ran a software company for many years, but also our organisation before my time ran a project similar to that, which was called Virtual Workspace, which failed hugely actually and cost quite a lot of money. So one of the first things when I started in my role, I was to read the lessons learned actually about that project, and as Khalid was saying, that the lessons really weren't about the technology stack. It was about the integration. It was about the involvement of the rest of the organisation. It was about the governance. It was about, as Sharon said, it was about the testing. So it's all of that stuff that sits around it that's so important if we are going to get that kind of piece right. But I still see that there's areas to innovate inside our organisation. So what I wanted to share with you really today was the journey that we're on. So if Fiona, you can move on to the next slide, I'll just share a little bit about that. I've talked about that. So where we've started in our journey is actually thinking about we have a reasonable stack of software that we use in our organisation. We've got about 19 software products within there, and about 8 of those are our core kind of products that we use. And obviously, having our fingers burnt before, what we're never going to do is build that software piece. But the question that we're starting to ask ourselves is, what if we actually decoupled this architecture? When we buy a piece of software, what we're actually buying is a data bit at the bottom. We then buy the sort of logic bit, and what we then also buy is that user interface, that bit at the front as well. And so the challenge for us was actually to say, some of the software we've got actually is all right in the database end of it, but the interface, the front end, is rubbish. Or actually, the front end is quite good, but the database is a bit rubbish. So actually thinking about ways in which we can provide other ways of looking at that and pulling that information out is the sort of journey that we've been going on. So if we jump to the next slide, Fiona, if that's helpful. Yeah, next piece, thanks. So what we've been looking at from our front sort of facing end of our journey is to say, how could we actually pull all of this information from various different vendors back into a data warehouse environment, and then from there create the information and the views that people need. So sort of almost replacing that UI, that user interface layer for all of our different stakeholders, which partly that's about our colleagues and the people that work for us, and actually ensuring they've got the right information, because at the moment they have to look through lots of different systems to get the information they need. So actually, what layers could we create out of our data warehouse for them? What layers could we create that actually enables the people we support to be able to view information about their care records, to be able to book appointments, to be able to tell us how they're feeling, tell us what service that we're providing, all of those kinds of things. And then the other two views is about what layers of information do we need to get out to our commissioners. We don't want them, we're not going to ever give them full access to all of our care records and full access to our email records, but what views could we create that's in that space? And again, that connection, as Paul talked about at the beginning, this really important connection now back into the health service, our sort of, we're living in this very much this David and Goliath environment with social care and health. And so actually, how could we proactively integrate information back to the NHS environment? So that's the sort of model that we are starting to look at and unpick. So if you want to move to the next slide. So our innovation really is around saying, is AI the new UI? So is AI the new user interface? So what if our staff could actually be using a chatbot to book their leave, or a chatbot to ask questions about when was the last time they were sick, or what pay they have, or any of those sorts of things, rather than having to go into a website, click on a button, click this, do this, and so on. So that's, and if we can get that right, the questions that they could ask could be actually questions about HR, but also questions about finance, or questions about their care plans, or questions about any other things as well within there. So that's the piece that we're thinking of now, is what we're starting to do is build our agentic architecture underneath that, and saying, actually, what agents do we need? How many agents do we need? And how are we going to architect those agents? And therefore, we possibly don't need to buy new software systems underneath them, because actually we're replacing the UI, the data sets we're using out of those come into our data reporting. And so actually we could probably save money there and invest in this kind of environment. Now, for people who have been around a long time, you would know this is middleware, that kind of environment. It's kind of nearly like that, but this idea of using a chatbot interface instead. And then if we move on to a slide, the next piece that we're sort of thinking about then is, how do we then push that out via a product or some products out to our external interface? And so again, thinking about how that can be dynamic, how it can be the right information at the right time to the right people using products like Power Pages. So that's the sort of way that we're looking at this now, and understanding, as Khalid said, that building your own software sometimes can be very investment heavy, very upfront heavy, whereas this approach hopefully is starting to think about ways in which we could do this quite quickly, relatively small investments, and build on that over a period of time. So Fiona, I hope that's helpful and gives some insights as to what we're doing.
Thanks so much, Kate. Really, really interesting. I think just, fascinating to hear about the really different approaches that all of you have taken, but actually to achieve similar things, at the heart of it is personalization, a good experience for our staff and our organizations about having the right data to support what we're doing. That's essentially at the heart of what we're all trying to do, but actually understanding that one size doesn't fit all, and actually everyone's going to approach it in a slightly different way according to your organization and your teams and your client group. Really, really fascinating. Thank you, Kate. So before we get to the Q&A, we're just going to have a quick few minutes from our lovely ethical hacker, Cyber Sam. As his title slide quite comically says, and then the annoying cyber guy shows up. So just a few little takeaways just to leave you thinking before the end of the session. So Sam, I will pass over to you.
Thank you so much. And I always feel guilty doing this because I do feel that I get called quite rightly sometimes the innovation killer because in cyber we are risk averse. That's what our job is. But if you guys constantly listen to people like me, never mind the caves, none of us would have left the ocean. So I'm going to take a flyby like tour around like thinking about security and development. This is just to dip toes into it, to think about security, but by all means, don't take it as absolute mandatory. You must do this, that, and the other, but do think about it if you are doing these things. So if we can go to the first slide. Oh, I forgot that I was going to tell you who I am. I'm Cyber Sam. You can see all the stuff that I've done there. I haven't done much development myself, but I am a certified information systems security professional, which is a ridiculous certification that I got, and part of that was doing development. So if we go on to the what I thought was the first slide, my apologies. Very quickly, just as a quick overview, I'm going to go through build versus buy versus AI. Didn't realize that rhymed until I just said it then, so that's good. I absolutely did that on purpose. So at the very highest level, if you're going to bring some sort of technology to help you into your organizations, generally speaking, there's two paths initially, which is build it yourselves or buy it in. This is a very simple like overview. So you can build it yourself, you create your own product, you design what it does. You or your team build it, you fix and you update it. Or alternatively, you can buy it in. Obviously, you buy a ready-made product or you get somebody to build it for you. Somebody else designs it, somebody else builds and maintains it, and you configure and customize it. That's generally speaking. And then relatively recently, we've got the AI coding products that are coming in, which is sort of a mix of both, where you use an AI company to help you create a product. The AI writes the code for you. Someone else maintains the AI, but you maintain what gets created. So, quick overview. That's kind of you like bringing software into the advantage. So if we go into the next slide, please. I'm going to go through security thinking about building your own software. So first of all, here's the 11 vulnerabilities by types category. Fiona, I left this in. We can ignore this. I'm not going to go into this much detail with anyone here. If you want to, I will absolutely go through it with you, but this isn't the time to go into all the 11 different vulnerabilities by types. So we go straight to the next slide. These slides will be shared with you, so if you do want to read it, by all means do it. Nice and simple. If you're building your own NCSC, which is the National Cyber Security Centre, which is the cyber side of our GCHQ that offers lots of advice, they have 8 principles of secure development and deployment of software. And I quite like it because it's easier to understand than that scary red table that I put in there. Secure development is everyone's concern. Keep your security knowledge sharp. Produce clean and maintainable code, secure your development environment, protect your repository, that's your code repository, secure the building deployment pipeline, continually test your security, and plan for security flaws. Things will go wrong whether you want it to or not, so just understand that resilience is part of that, even when you're developing things. So if we go to the next slide. So the way I've done these slides, because I know that I've only got 10 minutes to tell you about development, security operations, and all sorts of stuff, which is a lot to cram in. So what I've done is I've just put loads of links on these that you can go and explore yourself. So some useful tools and links if you're thinking about building security thoughts and stuff like that. Oh, definitely. Yeah, it was a good challenge. That it's like take 25 years of experience into 8 minutes. So some useful tools and links is your common weaknesses enumeration, also known as the CWE, the MITRE index, which will show you the current weaknesses, and you can concentrate on top 10, top 25, whatever works for you. You've got the CVE, which is a big one, which is your common vulnerabilities and exposures. I've put all the links there. You've got the CVE itself. You've got GitHub. They've got loads of different free projects that you can like test your coding and stuff with. And I also quite like CVE details because what that'll do is it'll break down a very complex and say, look, these are the highest risk ones. So these are the ones that you should probably concentrate on because nobody expects you to be able to stop every vulnerability, every weakness at every point. It's just not possible. And then you've got OWASP, Open Worldwide Application Security Project, and then the lovely NCSC, and you'd put it in that one, National Cybersecurity Centre has a developers collection, which is a bit easier to go. So if you're going to start anywhere, I'd probably start there if you are thinking of building your own. So if we go onwards, so what about if you're buying software in? So buying software in, most of this is generally supply due diligence. Like, who are you buying it from? Are they a secure company? So very simple, like questionnaire to ask them is, do you have, don't ask them, do you have, ask how do you as a bit of your due diligence. An example I've put there is instead of saying, do you encrypt data, just say, how do you encrypt data on portable devices such as laptops, mobile phones, tablets, and removal media in case of loss or theft. Things like that will give you more of an insight into a company. If they can't answer, won't answer, might be worth looking around a bit. External certifications of marketing language, they're always going to tell you what you want to hear. They're going to say, we use industry standard, whatever. Our security is state of the art. None of that actually means anything, unfortunately. That is sales speak for, please buy our product, give us your money. There are some fantastic software companies out there, and just like in any industry, there are some cowboys. So it is careful that you do stuff like this. So I'd recommend nice and simple. Here is our site. Look for their certification because that's a bit of an external look into like what they've done. And companies that are proud of what they're doing will absolutely have some one or all of these. So Cyber Essentials Plus, DSPT publication, especially if the social and care area. ISO 27701, and also the NCSC has an assured provider list of people that do different things. And if we go to the next slide, you should see like some links and things you can go to. I like the idea that you're just paying with a credit card to buy a whole purchasing thing in. That might happen. So again, like if you're buying stuff in some useful tools such as certification checks, external checks, obviously you've got your DSPT organization search, see if they've got a DSPT publication. You've got the IASME Cyber Essentials, see if they've got an up-to-date Cyber Essentials certificate or Cyber Essentials Plus. Then you've got IAF Search and you've got UCAS. You've got basically things that you can search if somebody's got certification. Because if I just tell you that I've got all these certifications, but there's no external proof, I have sadly come across companies that put certificates on their website, but they don't actually have it. They've just put the logo there. So this is just a way to say I'm risk averse. That's why I pick at things that I probably shouldn't do. And SOC 2 is another good thing to look at. And again, NCSC has some advice and there's some links there. Now, quickly, I'll shoot through some AI because a little bit in here. AI, as I say, it's a little bit internal, a little bit external. It's part build, it's part buying in. So you need to do supply due diligence on the AI company itself, but you also need to do some checks on the AI output if it's building things for you. The coding libraries the AI use secure? Has the AI had training in CVEs? That's common vulnerabilities and exposures. Has the AI considered GDPR principles? There's a lot of AI products from the United States that won't have those kind of considerations into its training. Where are the AI data center based? Where does the data travel to and from? That's important to think about ICO, GDPR. And the AI company itself might have certification, but that doesn't mean that the product it outputs will have that certification covering it as well. So these are kind of things to think about. So we go to the next slide, please. I'm flying through this. I'm so sorry, people, but these slides will be shared with you, I promise. Compliance checklist for AI adopters. Understand what types of data, you can read all this. The big things is there's a lot of things, ensure you have a legal basis for processing data under UK GDPR, and especially special category data under GDPR Article 9. All health data is special category. And then consider conducting a data protection impact assessment when you're looking at different AI companies. Yeah, and then some of the tools that are put up there are loads more tools than this, by the way, but I wanted to try and keep it as small as possible for people who just wanted to have a quick look, a quick understanding of some of the security behind it. So obviously ICO has loads of information. There was a big link, but it was massive, so I didn't bother putting it in there. But in the ICO, you can find stuff about AI. Understanding regulations behind digital technology in health and social care. There's Digital Regulations Innovation NHS.uk. I should probably promote us as Digital Care Hub because we've got a good bit of AI in social care progress and plans, and there's lots of links in our article of different things that you can look for. And then AI Cybersecurity Code of Practice is a government publication that's quite useful to look for if you're wanting to deep dive as much as that. And I think that might be me. It is, yes. And that is an AI picture of me that one of my colleagues made. It is actually me. So that was just a quick flyby thinking about security when you're bringing something in or building something. There's loads of things out there, but it's just so that if you've got this amazing idea and you want to go forward, just have a little bit of a mosquito Cyberman like myself in the back of your head going, okay, but what about this? Doesn't have to be for everything, but just a little bit. Thank you very much.
Thanks, Sam. Really, really useful. Appreciate that was a very quick canter through, but like Sam said, hopefully just enough to leave you with that little reminder of don't forget to think about cyber. So we've had a few questions ping through. So thank you very much for your engagement. We're going to kick off actually with Richard, who's going to speak his question. So I'm just going to enable him to talk in the chat, and then I'll return to the Q&A function. So Richard, I'm going to press allow to talk, and hopefully you'll be able to ask. Okay, Richard, you should be good to go.
Hello.
Hi, Richard.
Yeah, it was just so my name's Richard Curry. I'm working in partnership lead for Stockport Council, and I lead on things like co-production and person-centered approaches to care. And I have lived experience of social care myself. And my question is to kind of be Karen and Alan really, and that is, you mentioned kind of making using tech to make sure care became more personal. And I just wondered, in terms of both of your products, how much involvement you had from people with lived experience of adult social care when developing your products.
Thanks, Richard. Sharon and Khaled, I will pass over to you for.
Go on, Khaled.
With our own tools, initially when we first started, I would say that most of our involvement or most of our co-production was with care staff because they were the actual end users of the software. We have started to kind of have more involvement from service users, and that's particularly because we're now starting to look at things like family portals and so on, because the initial tool was very much the end user was the care staff. I think now that we are looking at, especially with the AI type stuff, where we're looking at using things like ambient voice to be able to record conversations and capture notes and then use those inputs to kind of help personalize and input into the risk assessments and care plans. We're now getting more involvement from service users and so on. The other area where there's been a lot of involvement is that we've especially around some of the training and training data and benchmarking and so on. We've been working with service users to get permission to use their data to train on and so on. So we've had that kind of involvement as well. But I think for us it's been mostly the care staff, but increasingly becoming the service users as the tool kind of develops in that direction.
Thanks.
Oh, thank you so much, Richard. I think we've really consulted with the people we support over a number of years on the model of care. So really focusing on care continuity, strong communication, making sure our training is fit for purpose. Our care workers are they're confident. We've matched the right carer with the right person that we're supporting, really. So I think we've really listened to their feedback. We invite them to coffee and cake sessions. We're constantly talking to our colleagues. I don't think we've necessarily gone out there and said we're building this new product. What can you feed into this? So they fed into the model, which is fed into the product. But I think absolutely, as we continue to develop our operational model, we can really communicate with the people we support more effectively. So yeah, I think that's a great point for me to take back. Thank you.
Thank you, Sharon. Okay, right, let's go to the Q&A that have just come through. So loads of people saying thank you, which is helpful. So thanks very much, guys, for your presentations. Sharon, what pain points will your new approach to rostering address, and why didn't off-the-shelf software address those requirements?
Oh, thank you so much, Anne-Marie. So I'm going to try and do this justice, but I'm sure other people internally would do a better job than myself. The pain points that it will definitely solve will be that manual rostering, that having to go into Google Maps, work out the travel time, plot that. So it's going to create so much efficiency and give our coordinators so much more time to drive the quality of conversations with carers, clients, families, etc., even healthcare professionals. We will be able to, it will automatically adjust the rotas as when changes happen, i.e. Care calls cancelled on arrival, hospital admissions, care calls cancelled, more than 24 hours where the income stops. So it's going to adapt to all of that to make sure that our carers are paid fairly. What we do is when we have cancelled calls, and we want to make sure we pay our carers properly, because I think that's the one thing that really upsets me, is when that's why we have 0 hours contracts, because the money doesn't flow properly. What we want to do as an employee-owned organisation is make sure that we value our care workers, but on the flip side, we would like them to make a difference. So we've also created what we call the above and beyond approach. So our system will help us do that better. So when we've got cancelled calls, right, we'd still like the care workers to be out in the community. What else are they going to do? Or it will just drive all of that behaviour. Carers will be on a 2-week rolling rota, permanently allocated to runs. That will give us that care continuity. The quality of data. You can have permanent allocation of care workers, but if they're allocated across so many runs, they've still got multiple care workers going in every day, which isn't good. So it'll have a lot more management information to sort of say, look, this client's got more than X many carers. So we'll be able just to look at it more. It's just going to drive quality, I think. But yeah, can I come back next year and tell you?
Thank you. Yeah, we'll take you up on that. Okay, Kate, one for you. Anne-Marie has said, love your take on agentic AI and the new user interface. How will your agents cope with unstructured or poor quality data? Are you planning to open source agent architecture or skills to enable wider use of the results?
Yeah, thanks, Anne-Marie. It's a great question. We have implemented over the last 12 months a huge data quality improvement project, and part of that was getting all the data into data warehouse. And now what we run on a regular basis, and by regular, I mean, I think it's twice weekly now, quality audits on all of our core data. So our data sets have improved from data compliance of around 68 to 70% to nearly 90 something percent now, which is tremendous. So that's been, in some ways, the hardest bit of work, was actually building the fit for purpose nature of our data sets. And we do it now in a bit of a scorecard. So each area are in kind of competition with each other to see who gets the highest score in their data quality. So that's been a real culture change in the organisation. So in terms of data quality, that's how we've really picked that up. The other piece that we're doing is within our Azure Foundry. I won't get too technical, but we are part of the orchestration is a search environment. So defining for the agents which search pools to use, which ones not to use, how to build that stuff. And I think that's one of the bits that often when people are trialing agentic environments, they forget to do in the first place. So there is an element of how you build that sort of tooling to really be really clear about where that's going. So I think those are the sort of two things I would talk about in terms of those data flows. What was the second part of the question? Sorry, it was around.
That's right. Second part was just asking
open source,
to use open source agent architecture.
No, we are going to develop it through Microsoft Azure environments. But one of the things I would love to call to the rest of the sector to say is, can we do it together? Because we can't build every agent ourselves, and wouldn't it be great if we could start to actually share agent architecture and be able to sort of, look at ways in which we could build this as a sector. The NHS are building it as a sector on top of their federated data platform. At the moment, we're all trying to do it independently, and it's going to cost us too much to do that. So there is something about how we actually could build this together.
Thanks, Kate. Brilliant response. Okay, a couple of questions from someone who I know has left the call, but we'll cover them anyway, because I'm sure they will touch on other people, and I'm sure they will watch the recording. So absolutely agree with Sharon and Khaled about getting technology and systems fit for purpose. How can independent providers balance the cost burden and return on digital and data tech investment?
Shall I go first?
Thanks, Sharon.
Yeah. Okay, it's a good question. All I can say is what we did. I think we are an employee-owned organisation, so we didn't have any external shareholders or any debt. So we were able to use some, earmark some of our reserves to invest in this. I think we did take quite a cautious approach. As we built a partnership with developers who we brought our knowledge about what it was that was needed, and we could build the specification, and they actually put some time in. So for a long time there was no cost. And then obviously so you start to get the confidence whether this is going to work or not. Then we started to incur some costs. So we did it knowing it was a risk. We've done it as sort of a loan from the delivery from Be Caring to Careview, but it's a difficult one. I think we always did it knowing that we potentially could lose this money, but we knew we could afford to do it. That there are potential investors out there that may take that you could develop a partnership with. I think what I would say is if you are confident you've got something unique, you've got to be better than your competitors. There's no point building something, I think Khaled said it, building something that's already there, or even something that potentially could be quite easy to replicate in a bigger system. So it's weighing up the risk versus potentially losing everything, but the return of, well, what will happen if this does work? What's the benefits not only to your organisation and the quality of care you deliver, but actually from a commercial point of view, could you take that to market? I don't know if that answers it, but I think it's the best I can do.
Thanks, Sharon. Khaled, anything?
Yeah, just reiterating everything that Sharon said, but I think we're almost as small as you can get. I mean, we had 3 nursing homes at one point. We just got the one at the moment. So we're a small care provider. In terms of how do you manage the resources? If you're building your own innovation and so on, I think it's if you don't intend to commercialize it, then the problem that you're solving has to be big enough to justify the investment. So you need to be solving a problem that's big enough for your organization to justify that investment. And I think it goes back to what I said before, is that you don't underestimate how much it costs to do this kind of innovation. There will be I would add a little bit of a caveat to that. So I think if you're dealing with any kind of data that's to do with, resident data, personal information, there's an additional cost to that because of GDPR, because of security and so on. If you're doing innovation around things of data that's not that sensitive, so things like policies and procedures and so on sort of thing, the cost of, probably the cost of developing solutions in that area is a lot lower cost because you don't you always want to think about cybersecurity, but if somebody gets to see one of your policies sort of thing, is it going to be the end of the world sort of thing? So I think the first thing I would say is that if you're not looking to commercialize it, you need to be solving a problem that's big enough to justify the investment. But then the other side of it is that if you're doing something innovative enough, is it something that that other providers might be interested in? And that's the other way to kind of scale up to scale up the investment sort of thing. So and I think if you are going to commercialize it, which is I'm not actually not following my own advice here, which would be if you're looking to commercialize, I would say build something, build your MVP, build something that is useful, but maybe doesn't have all the bells and whistles on it, and then test your thesis quickly with other care providers because they will give you feedback. Because I think if you are trying to commercialize and you could end up investing again a long way and end up building something that nobody else is interested in. So yeah.
Thanks, Khaled and Sharon. Really useful responses. Okay, Khaled, you're staying live. So thanks for your excellent presentation and sharing your example of digital transformation. Would you be able to say any more about workforce training in meeting your DT, which I'm assuming you mean digital transformation strategy, and assist them to become ready for the agenda of transformation?
Yeah, so I think first of all, I think getting our care staff involved in the development process was really got them on board. They were really kind of like I said, so we didn't have in the end we didn't have any resistance at all in terms of adopting adopting the systems. Staff were actually quite excited about it and constantly asking us, when's it going to be ready, when's it going to be ready, and so on. In terms of the actual rollout, what we did is that we identified people in the organization who were the early adopters or like the champions and so on. And so we did a very much the sort of trainer approach. So those people would be the ones who were most involved in terms of giving us feedback, and they were also the ones that we would train them up. They would do a little bit of testing with us and so on as well. And then they would be the ones to go and train up the other staff in terms of cascading the training out. So I'll give you an example. When we went live with the main bulk of the system, we had allocated about a month to do it, but we did the training and they cascaded the training out within a week, and probably in under 7 days sort of thing, we went live with the whole thing from turning it on and getting the staff to use it. So it went very, very quickly. But I think that was because I don't think you can really think of it as that 7 days. It was all the upfront work that we had done around kind of the co-production, the co-development work, and so on. But in terms of the actual rollout, it was very much a kind of train the trainer, using champions and then train the trainer type approach.
Thanks, Khaled. Really useful. Okay, this question isn't aimed at anyone particular, so I think it's going to be a tricky one to answer, but if you can all get your thinking caps on. So I've worked in health and social care for 15 years in senior roles and have moved into developing workforce and compliance technology for care providers. Funding opportunities feel limited and often disconnected from real operational need. What advice would you give to sector experienced practitioners trying to innovate responsibly and access funding that genuinely supports care delivery rather than short-term pilots? Thank you, Jamie. That is a fantastic question. I'm not sure if anyone's got any immediate thoughts on that. I feel like Kate's coming in.
Fiona, yeah, it is a great question because I think it is a real issue in our sector. I was just reading today that Kingston NHS have got £7.5 million investment into their AI environment for one small, well not small, but one borough of NHS. There are very few investment opportunities for the social care sector because we're seen as being so disparate. And I think there is something about us going back to government and saying we do need some innovation pipeline money. We do need to be able to draw on some stuff, because if anyone's done an Innovate UK grant, they are, reasonably easy to apply for, but so difficult to manage and maintain in a normal sized organization. So there's something about, actually, if there is one ask out of the Casey Commission, would be to build an innovation and grant environment for us to be able to innovate.
Thanks,
I'm sorry that
Kate.
doesn't answer the question, but that
No,
was just
thank
my
you.
soapbox.
It's sometimes there's no definite answer, is there? But it gets
No.
everyone
I
thinking.
can
And
probably
you know,
add a little bit to that.
Khaled,
We've been in this ballpark. So we've applied for things like the Innovate UK Smart Grant. So let me just I'll take a step backwards. So as far as I'm aware, I've not come across any funding available, grants and so on, for specifically for developing new products. So there was a few years ago, there was a grant available, an adult social care technology grant, but it was mostly around taking existing products and scaling them up and kind of doing like a scaling fund. But I'm not aware of any grant that around for developing new products specifically for social care. There is an Innovate UK Smart Grant, but
Yeah.
that smart grant is available to anybody developing any technology. So when you compete for it, you're competing against people who are, I don't know, probably developing cures for cancer and all kinds of other things. So it's very, very competitive to get that grant. But you can apply for those kinds of things. I think the only other sources are going to be, well, the other sources I can think of are going to be partnering with a care provider who wants to develop the technology in that space, or potentially so finding like an early adopter customer to work with. And the other one would be around something like venture capital, or what is it?
Equity investment.
Yes, that's some sort of investor sort of thing. The slight challenges is that that social care is a niche market, so you kind of have to be able to, especially VCs these days, you have to pitch something that's going to be a big enough opportunity to make it worth their interest. But that's all about finding the right pitch and the right opportunity and so on. But unfortunately, not many grants specifically for this area.
thanks both Khaled and Kate. And Carl has just put some useful reminder on the chat around thinking about universities and NIHR route for support and evaluation, which might support in one direction. So final question, and this came from Carl, who just gave the useful advice actually, aimed at yourself, Khaled, around implementation science. And obviously just picking up on that sort of challenges and barriers theme, and actually, other than sort of common sense approaches, did you consider using a more scientific sort of implementation science tools as a way of embedding sustainable use within your sort of rollout of your system?
So no, we didn't really. So most of our approach to everything has been try something out, have a go at it, sort of thing. And then if it, and that's been our approach to both developing the software and rolling it out and everything as well. So the short answer to the question is that no, we didn't look at those kind of more scientific approaches to adoption and so on. Some of the things, so I think the current version of what we've developed, that care plan builder that I showed you, is probably something like version 7, 8, 9, or 10 or something like that. We've iterated over many times, and to get to where it was. And we looked at, slightly touching on what Kate was talking about earlier around is, so we're also looking about, I think, a question about is the chatbot the new user interface? So we spent quite a lot of time, looking at in terms of adoption and so on, making the user interface as easy to use as possible. So we've kind of got like a rule that we want staff to be able to use the system without any kind of formal training, so that they can just kind of like pick it up and just use it. If it's along the same sort of idea as if you go onto an Amazon website or something like that. Nobody ever gives you a training course. You just kind of figure it out as you go along. So
Yeah.
we've tried to adopt those kind of approaches to building the tech, so somebody could just kind of use it very quickly. But the short answer to the question is that we haven't really taken any scientific approach to it.
Thank
It's
you,
just
Khaled. Right, I'm going to stop everyone there because we are going to cut off in literally a minute. So just to say thank you all so much for your engagement. Thank you to the speakers. Thank you for all your questions. As we said, slides and recording will be sent out, and I'll try and send any other useful information that was shared in the chat in that email as well. So thank you all so much, and have a great rest of the day. Thanks, guys.
Thanks, Fiona. Thanks, everyone.
Thanks,
Bye.
Fiona. Bye.
Thank you, everyone.